Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have a renowned orthopedic surgeon, Dr. Vinay Kumarswamy. He has not only trained in orthopedic surgery in Bangalore Medical College, worked there, and also in Varanasi, and also he has got a sports injury management training from England. And he has done more than 1,000 cases of surgery on knee joint, including knee replacement and other arthroscopic surgery also. And he is expert in that. So we are very, very happy to have him. Welcome, sir.
Thank you, madam. Thank you for the opportunity to be
Okay,
here.
yeah. Most of the people, when they grow old, they start getting waddling gait or they start getting pain in the knee joint. And what do you say? Can they avoid it, or why does it occur?
It is something which is not avoidable after a
Hmm.
certain age. Almost all of us get a certain degree of arthritis, but it is
Hmm.
definitely postponable. It can be
Okay,
delayed.
okay,
Uh, Most of us have knee arthritis as a secondary side effect of evolution.
okay.
When we were animals and we were walking on all fours, the weight of the body
Hmm.
was divided by four and was
Hmm.
borne by four limbs. We humans evolved into people walking on two legs. That has freed up our hands.
Hmm.
So we have created this entire world because our hands are free. We can use
Hmm.
them to make tools and we can
Hmm.
use them to manipulate. The side
Hmm.
effect of that is the entire weight of the head, the upper body, that trunk
Hmm.
keeps falling on those two knees for nearly 40, 50, 60 years. Because
Hmm.
of that, arthritis develops. Like the
Okay.
graying of hairs.
Hmm.
We don't call graying of hairs a disease. So knee
Disease, yeah.
arthritis is similar. Knee arthritis
Right.
is something which happens with aging and it should
Okay.
not be called a disease. However, we
Okay.
can definitely prevent it from happening at an early age.
Hmm. And when you say for prevention, I realize that those who are overweight, they get it more. Whereas those who have maintained their weight well, and even when they're 80, 90, I have not seen them getting the waddling gait, the walking like duck. What is the reason for this duck like waddling gait?
The knee joint has got two parts. We call it the medial side and the lateral side. The medial side
Okay.
means the inside of the knee, the lateral side means the outside of the knee.
Hmm.
Naturally, the inside of the knee takes around 60% of the weight, whereas the
Hmm.
outside of the knee takes around only 40% of the weight. So,
Hmm.
when over the lifetime of a patient, 40, 50, 60 years,
Hmm.
60% of the weight keeps going through the inside of the knee, that
Hmm.
wears out much faster. So,
Okay.
medial sided arthritis happens early and because
Hmm.
of which this deformity develops. This is called a
Hmm.
bow knee or a bow leg, where the
Hmm.
patients have a varus alignment. That means their knee become like a bow, and they
Hmm.
develop this waddling gait.
Hmm.
When the arthritis progresses further, and if it's not treated at an early age, they develop arthritis on the outside of the knee.
Okay. Like I'm a cardiologist. I have seen over the decades the heart attack has increased. Similarly, do you think the arthritis, this osteoarthritis, has increased in the recent days? Is there a lifestyle, which has got any impact on this arthritis?
And definitely, we just now came out of the COVID pandemic, but we are
Okay,
in the middle of an obesity pandemic.
correct.
Obesity.
Very well said.
So
More than
obesity is.
30% of the children and women are also obese now. Correct.
Yes, yes. So a knee which was supposed to take around 60 kilograms of weight, if it has to
Hmm.
take 70 kilograms of weight, 80 kilograms of weight, or 100 kilograms of weight, definitely
Okay.
it wears out much faster.
Hmm.
So
Hmm.
obesity is a big cause of knee arthritis,
Hmm.
and so also we see more cases of arthritis because of lack of physical activity. My
Okay.
grandfather used to work in Vidhan Sauda. He used to cycle
Okay.
from Jayanagar 40 block to Vidhan Sauda
Great.
every day as a part of
Great.
his job
Great.
because
Correct.
vehicles were not available at that time.
Okay.
Now, even if we have to go buy grocery from a store which is zero point 0.5 kilometers, we either blink
You go
it
by car.
or use the car.
Okay.
So, lack of physical activity is another big reason for early arthritis or more
Excellent.
incidence of arthritis these days.
Yes. 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 Do you think it is more common in women or men, or it is impartial to the gender?
Uh, obesity, at least in the Indian scenario,
Hmm.
is a little more in women compared
Okay.
to men,
Men.
because somehow men are more involved in physical activities,
Hmm.
and women are less involved in physical activities, at least in the Indian setting. So, because
Okay.
the incidence of obesity is more in our women, the incidence
Hmm.
of arthritis is also more in women. It is more to
Yeah.
do with weight rather than the gender.
Correct, correct. Absolutely right. Because the body weight has to be on the knee joints only. And in fact, in the olden days, the women used to do all the household work, including the sweeping and grinding and everything. So they were quite happy and well. But today, hardly there is any work. And most of the time, they are like couch babies sitting on the sofa watching the serials. And as a result, the women have got the more obesity. I agree. But do you think you have any exercises which can prevent the arthritis or postpone the arthritis? Or what are the special, I want to say, the exercises once they get the arthritis?
We generally recommend yoga to most of our patients,
Okay.
because primarily it is something which everyone can do at any
Hmm.
age. It exercises
Okay.
every muscle and every joint in the body, and it is
Okay.
something which does not require a lot of equipment. So, yoga is a great exercise.
And when
Which
you said that every joint and every organ in the body, I remember Surya Namaskara is an ideal one because head to toe, all the 250 ligaments or joints or whatever you say, they get the exercise. There are 12 asanas in Surya Namaskara, and it is excellent. Usually, I joke and tell, if you do 108 Surya Namaskara, you don't have to call the 108 ambulance. So that is, whether it is not only arthritis, even for heart attack or anything. So Surya Namaskara is very good because you get the vitamin D. When you do it in the sunlight, you get the vitamin D. And
Yeah.
vitamin D is important for heart as well as for your joints. What do you say about it?
Absolutely, absolutely. Vitamin D is extremely important, and it is something which is also another pandemic. Vitamin D deficiency is quite common
Yes.
because we
Yes.
all work indoors and we
Mm.
hardly have any exposure to sunlight. So vitamin
Yeah.
D deficiency is quite common, and vitamin
Mm.
D supplements are being given to a lot of people. That is what
Mm.
is the advice I give my patients also. Don't go to a park where there is a lot of shade, where no
Okay.
sunlight would fall on you. Go to
Mm.
a place where sunlight would fall on you. Wear short clothes so that more skin is exposed to sunlight, and do
Sunlight.
exercises in such a scenario.
Okay, okay. So you say that be modern and wear the like banyan like things and Bermuda and walk freely on the
No
sunlight
harm
and
in
get.
that. You will get more vitamin D, madam.
Okay, that's great. And my one question is, no, once they get this kneecap that we wear, no, to protect the
True,
knees, do
true,
they help?
true. Definitely, definitely. They help in the beginning when a
Hmm,
patient comes to us in the clinic
hmm,
with a lot of knee pain. In that
hmm,
acute scenario, in that
hmm,
short-term period, we advise them to wear a kneecap, which
hmm,
supports the knee a little and prevents the pain from coming. But a long-term use or dependency on those kind of braces is
hmm,
definitely not recommended, because
hmm.
your muscles are supposed to hold your knee together. If you are
Okay,
constantly wearing your kneecap or your knee brace all the time, the muscles have no function and the muscles will start becoming weak. So,
okay.
definitely in the short term, they have got benefits, but
Hmm.
one should not become dependent on them all the time.
Yeah, like sportsmen wearing it, for the protection. I wear
Yeah.
it when I'm traveling and flying or in the morning walk. And I feel that I'm quite safe. Even if I topple and fall down, I may not injure much. So that is the thing. Now, can I ask you the rapid fire questions and then so that people will know what to do, what not to do, because do's and don'ts are very important. Now, do you recommend walking is good?
Absolutely. Very good.
Yeah. What sort of walking do you advise? I go in the figure of eight, and the figure of eight, according to Siddha, it is a very good way of walking. So, just normal pace or fast walking, or what sort of walking?
People who don't have much of arthritis in early stages of arthritis, or people without arthritis, they can
Hmm.
do a brisk walk. People with more
Hmm.
advanced arthritis, grade 3, grade 4 arthritis is what we call more advanced arthritis. For them,
Hmm.
we recommend not to do a brisk walk.
Okay.
But for others, yes, the figure of eight walking or the side walk and a
Hmm.
careful back walk and walking on
Backward.
an inclined
Backward.
plane,
Yeah. Yeah. I
walking
do the
up
back
and
walk
down,
also. Yeah. And what
walking up and
about
down
the
the inclined
jogging?
plane is good.
I know. What about
Uh,
jogging?
Great exercise, a great exercise. Jogging
Hmm.
is not only an exercise for the lower body. There's a
Hmm.
lot of exercise that happens to your upper body and your trunk also.
Hmm.
Jogging is a great exercise. A lot of people come and ask me that, there's a myth, whether it's true or not, that jogging causes arthritis, you should not run. It is
Yeah.
a myth. It is not a fact. People who
Oh,
jog regularly have less chances of arthritis. Arthritis is basically loss of cartilage. There is a
okay.
smooth covering of the joint that is called cartilage. When we
Hmm.
constantly keep loading it, like standing in one place for a very long time, like
Hmm.
teachers, surgeons, traffic police,
Hmm.
is not good for the cartilage. But episodically loading the cartilage, like jogging, like
Hmm.
skipping, so
Hmm.
that makes the cartilage much thicker and makes
Hmm.
it last longer. So jogging is a great
Okay.
exercise.
Okay. What about climbing the stairs? People say that climbing the stairs will reduce their weight, but in the bargain, already they're obese and they try to climb. What about the climbing?
It is not a bad exercise for
Hmm.
people who don't have arthritis, who want to reduce their weight. It's a great exercise. You are working against gravity when you're jogging,
Okay.
when you're walking. The gravity is not acting against you. But when you're
Yeah.
climbing stairs, you're putting more effort. So that is
Hmm.
a good exercise for people who are normal, who want to reduce their weight, and people with early arthritis. For people with more advanced stage arthritis, it can lead to faster progression of arthritis. We don't
Okay.
recommend that to them.
Yeah, because when they are climbing, though, 500 times more strain is there on the knee joint. So that's absolutely right. What about climbing down? Is it the same or better?
The effort needed is less in climbing
Hmm.
down.
Hmm.
However, it depends on where the arthritis is. There are some people who find more pain
Hmm.
while climbing stairs, and there are some people who find climbing stairs is easier, but getting down is more painful because that area is more damaged in them. So it depends
Ah.
on each individual person.
Okay, okay. What about cycling? We had one professor, pharmacology professor. He used to come to the hospital cycling, and when his wife got admitted for heart attack, then he said, "Do treadmill for me also." To my utter surprise, he walked for 25 minutes, unimaginable. So the stamina he had was because of the cycling. What do you say about cycling?
True. Definitely, definitely. Cycling is a great exercise. It
Hmm.
it uh, it burns calories also. It's a good exercise for the heart and lungs, and it builds strength also. It's a good
Yeah,
exercise, and there's no impact involved.
yeah.
Jogging involves impact where you are impacting. It's not good for people with arthritis. Cycling has no impact. You don't lift your leg off the pedal.
Yeah,
So because
body
there's no
weight is
impact,
not
it's
on
good for
the,
arthritic
yeah,
knee.
yeah. And not only that, if you don't want to go in the jungle of traffic with the cycling, you can do it at home also. You have
True.
a part of
Yeah.
the, I mean, what to say, like a gym
Stationary
like thing,
cycling.
yeah, stay
Yeah.
cycling at home also. And what about swimming?
Swimming is a wonderful exercise, can be done by
Hmm.
any person. We told that jogging and brisk walking is not recommended for people with advanced arthritis. Whereas
Hmm.
because of buoyancy, the body becomes very light inside the water and the pressure on the joints is very less. So
Okay,
swimming is a great exercise. It burns a lot of calories, builds a lot of strength, and it helps a lot in a lot of conditions, and it does not put a lot of pressure on the joints. It's a great
okay.
exercise.
Yeah. What about Ganpati Namaskara, holding the ears and doing the ut bais,
Squats, full
squatting and
squats.
yeah,
Yeah,
yeah.
yeah. Squats are a great exercise to build up something called as quadriceps. The front of the thigh muscle is
Mm,
called quadriceps.
mm.
So, a full squat is a great exercise to build up quadriceps strength, and definitely recommended at least once a week or twice a week, if not daily.
Okay. Anyway, I do it daily because I didn't meet you earlier to get your recommendation. But anyway, jokes apart, what about this, quadriceps contraction and releasing when you are working in the kitchen or everywhere? Is it not an easy way that the women can exercise their thigh muscles?
Definitely, definitely. That is called a static quadriceps exercise. Static
Yes.
is you don't move your quadriceps, but you are still contracting. That results in something called as isometric exercise, which is wonderful for muscle strengthening. When you're not doing anything, that's a good exercise to do. But in isolation, that is not enough. It's good to do a combination of isometric and isotonic exercise.
Yes.
Isometric is when you don't move your joint at all. Combination of where you're moving your joint also, which is called isotonic exercise, will be better.
Okay, great. Thank you very much for a very lucid and a clear description of arthritis. And since you are an expert in the knee surgery, so we'll have the next episode about the treatment of arthritis and how the surgery is done and all that. Thank you very much for your kind
Pleasure
explanation.
being a
Thank you.
part, madam. Thank you very much for
Thank
the
you.
opportunity. Have
Thank
a
you.
good day.
Thank you. Okay.
Thank you.
Vinay,
ಎಸ್ ಮ್ಯಾಮ್.
ಅಲ್ಲ
ಸಾರಿ, ನಾನು
ಅವ್ರಿಗೆ
ನಮಸ್ಕಾರ ಮಾಡಕ್ ಆಗ್ತಾ ಇಲ್ಲ, ಯಾಕಂದ್ರೆ
ಇಲ್ಲ
ನಾನು
ಇಲ್ಲ
ಮೊಬೈಲ್
ಪರವಾಗಿಲ್ಲ
ಇಟ್ಕೊಂಡಿದ್ದೀನಿ
ಪರವಾಗಿಲ್ಲ
ಕೈಯಲ್ಲಿ.
ನೋ 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 ಪ್ರಾಬ್ಲಮ್. ವಿನಯ್,
ಹ್ಯಾಂಡಲ್
ಅಮ್ಮ
ಇಟ್ಟಿದ್ದೆ
ಏನ್
ಕೇಳಿಸ್ತಿದೆ.
ಮರ್ತಿದ್ದೆ.
ಗೊತ್ತಾ,
ಹಾ ಅಮ್ಮ.
ಅವ್ರ ಹತ್ರ ಪಿಕ್ಚರ್ಸ್ ತಗೊಂಡು ಆ
ಹಾ.
ಪಿಕ್ಚರ್ಸ್ಗಳನ್ನ ಹಾಕಿ. ಅದರ್ವೈಸ್ ಬರೀ ಟಾಕ್ ಆಗಿ ಹೋಗ್ಬಿಡುತ್ತೆ. ಅವ್ರು ಹೇಳಿದ್ರಲ್ಲ ಕಾರ್ಟಿಲೇಜು, ಆಮೇಲೆ ಹಾಕಿದ್ಮೇಲೆ ಅವ್ರ ಹತ್ರ ತೋರಿಸಿ ಸರಿಯಾದ ಪ್ಲೇಸಲ್ಲಿ ಹಾಕಿದಿರಲ್ಲ ಅಂತ ಇದ್ ಮಾಡ್ಕೊಂಡ್ಬಿಡಿ, ಕನ್ಫರ್ಮ್ ಮಾಡ್ಕೊಳ್ಳಿ.
ಅಮ್ಮ
ಆಯ್ತಾ?
ಕನ್ಫರ್ಮ್ ಮಾಡ್ಕೊಂತೀನಿ.
ಓಕೆ. ಆಮೇಲೆ ಅವ್ರ ಮಾಡೆಲ್ದಾಯ್ತು ಏನಾಯ್ತು, ಎಲ್ಲೆಲ್ಲಿ ಪಿಕ್ಚರ್ಸ್ ಬೇಕು ಏನಂತ ನೋಡ್ಕೊಂಡು ಹಾಕ್ಬಿಟ್ರೆ ಚೆನ್ನಾಗಿರುತ್ತೆ. ಆ ಜಾಗಿಂಗ್ ಮಾಡೋದು, ಸೈಕ್ಲಿಂಗ್ ಮಾಡೋದು ನೀವೇ ಹಾಕ್ಬಾರ್ದು, ಸೂರ್ಯ ನಮಸ್ಕಾರ ನೀವೇ ಅನಿಮೇಷನ್ ಹಾಕ್ಬೋದು. ಬಟ್ ಜಾಯಿಂಟ್ದು ಡಾಕ್ಟರ್ ವಿನಯ್ ಅವ್ರ ಹತ್ರ ತಗೊಳ್ಳಿ, ಆಯ್ತಾ?
ಹಾ
ಈ
ಬಸ್.
ಗಣೇಶ ನಮಸ್ಕಾರ,
ಓ,
ಫುಲ್
ನಮಸ್ಕಾರ.
ಸ್ಕ್ವಾಟ್ ಅದೆಲ್ಲ ಅದೆಲ್ಲ ವಿನಯ್ ಹಾಕ್ಬೋದು.
ಹೌದು ಹಾಕೊಂತೀನಿ ಸರ್.
ಓಕೆಪ್ಪ. ಆಮೇಲೆ ನೆಕ್ಸ್ಟ್ ಟೈಮ್ಗೆ ನೀವು ನಿಮ್ದು ಕ್ಲಿಪ್ಪಿಂಗ್ಸು, ಸರ್ಜರಿ ಮಾಡೋದು, ಆಮೇಲೆ ಅದು ಸ್ಕೋಪ್ ಇದ್ ಮಾಡಿದ್ದು ನೀವೇ ವಿಡಿಯೋ ಮಾಡಿದ್ರೆ ಅದನ್ನ ಅದರಲ್ಲಿ
ಖಂಡಿತ.
ಸೇರಿಸ್ಕೊಂಡ್ಬಿಡ್ಬೋದು.
ಹೌದು
ಅಂಡ್
ಮೇಡಮ್.
ಪೇಷಂಟ್ ಬಿಫೋರ್ ಅಂಡ್ ಆಫ್ಟರ್ ಮಾಡಿದ್ರೆ ದಟ್ ವುಡ್ ಬಿ
ಶೋರ್
ವಂಡರ್ಫುಲ್.
ಸರ್.
ಸೊ ಯು
ಶೋರ್ ಶೋರ್.
ಟೆಲ್ ಅಸ್ ವೆನ್ ಯು ವಾಂಟ್ ಅಂಡ್ ವಿಚ್ ಟೈಮ್ ಯು ವಾಂಟ್, ಅಕಾರ್ಡಿಂಗ್ ಟು ಯೋರ್ ಟೈಮಿಂಗ್ ವಿಲ್ ಅಡ್ಜಸ್ಟ್, ಪ್ರೊವೈಡೆಡ್ ಐ ಮೀನ್ ಸ್ಟೇಷನ್.
ಓಕೆ ಓಕೆ, ಸರಿ ಮೇಡಮ್. ಕ್ಯಾನ್ ವಿ ಡೂ ಇಟ್ ಸೇ ಆನ್ ವೆಡ್ನೆಸ್ಡೇ?
ವೆನ್ಸ್ಡೇ ಫೈನ್, ನೋ
ಪಾಸಿಬಲ್?
ಪ್ರಾಬ್ಲಮ್.
ಓಕೆ, 5 PM ಐ ಬಿ ಇನ್ ಮೈ
ಎಷ್ಟು
ಕ್ಲಿನಿಕ್.
ಗಂಟೆಗೆ? ವಾಟ್ ಟೈಮ್?
ನೀವು ನಾನು OT ಲಿ ಇರ್ಲಾ ಅಥವಾ ಕ್ಲಿನಿಕಲ್ ಇರ್ಲಾ?
Anywhere, whatever it is, the clarity must be there, so that you know the ನಿಮ್ದು ವಾಯ್ಸ್ ಸ್ವಲ್ಪ ಹಾರ್ಶ್ ಆಗಿ ಬರ್ತಾ ಇದೆ. ಜಸ್ಟ್ ಚೆಕ್ ಯುವರ್ ಆಡಿಯೋ.
ಓಕೆ ಓಕೆ.
ಐ ಮೀನ್ ಮೇ ಬಿ ಇಟ್ ಇಸ್ ಟೂ ಲೌಡ್ or ವಾಲ್ಯೂಮ್ ಇಸ್ ಮೋರ್, ಐ ಡೋಂಟ್ ನೋ. ವಿನಯ್, ಅದು ಸ್ವಲ್ಪ ನೋಡ್ಕೊಳಪ್ಪ.
ಹಾ ಅಮ್ಮ
ಅವ್ರ
ಚೆಕ್ ಮಾಡ್ತೀನಿ
ವಾಯ್ಸ್
ನಾನು.
ಅವರಷ್ಟೇ ಸ್ಮಾರ್ಟ್ ಆಗಿ ಬರಬೇಕು.
ಹಾ ಸರಿ ಅಮ್ಮ.
ಓಕೆ ಓಕೆ ದೆನ್, ಥ್ಯಾಂಕ್ ಯು.
ಓಕೆ ಮ್ಯಾಮ್, ಥ್ಯಾಂಕ್
ವಿನಯ್,
ಯು ವೆರಿ ಮಚ್.
ವೆನ್ಸ್ಡೇ
ಥ್ಯಾಂಕ್ ಯು.
ಅವ್ರದ್ದು,
ಹಾ ಅಮ್ಮ.
ನಾಳೆಗೆ ಡಾಕ್ಟರ್ ಉದಯ್ ಪಾಟೀಲ್ ಅವ್ರದ್ದು, ಟ್ಯೂಸ್ಡೇಗೆ ಇವ್ರದ್ದು
ಪವನ್ ಶ್ರೀವಾಸ್ತವ.
ಪವನ್ದು, ವೆನ್ಸ್ಡೇ ಇವ್ರದ್ದು. ಓಕೆ
ಓಕೆ ಅಮ್ಮ.
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು ಸೋ
ಓಕೆ,
ಮಚ್.
ಥ್ಯಾಂಕ್ ಯು
ಬಾಯ್
ಮೇಡಮ್. ಥ್ಯಾಂಕ್ ಯು. ಬೈ ಬೈ.
ಓಕೆ, ಗ್ರೇಟ್.